Doctor, could you summarize your current thoughts on how you approach psychiatry?
I am a traditional psychiatrist. By that, I mean I do psychotherapy in 45-minute sessions. I help people to resolve the problems that give rise to such symptoms as depression and panic attacks. I give medication only if I believe medication will facilitate recovery. When you dampen anxiety, it's easier for the person to remain in treatment and to deal with issues that are causing them to be anxious. I meet with patients weekly for 45-minute sessions. There are only a few of us doing psychotherapy as psychiatrists. Psychiatrists change their orientation to a biological approach. There's a steadfast belief among current psychiatrists that our problems are biologically determined, that we don't create the problems, our brain creates the problems. So they believe if they look at the symptoms like anxiety and give a tranquilizer, the person will improve and the person will function well. I don't accept that, and other psychiatrists don't accept that, certainly psychologists don't. Depression is a symptom. It's the problem that gives rise to the symptom that should be addressed. Medication is not sufficient. I do counseling. I work with families, I work with individuals. I give medication very prudently. For example, studies have shown with antidepressants are only effective in severe depression. By this I mean where a person doesn't talk, doesn't laugh, and doesn't eat. Anything less than that is something a person can function, although troubled. And also, we can work through our problems. The message with medication is that you can't work through your problems. It's the medication that helps you with your problems, but you're not capable of working through your problems. Well, I don't take that position. And furthermore, there's also a confusion. A psychiatrist who functions by giving medication, they're called psychopharmacologists. If a person is on an antidepressant and a person gets better, the doctor attributes to the antidepressant. But we all have moments of depression. It's a common human feeling, just like happiness, that even without medication, we recover from a depression. That's just the way we function.
So the drugs you're saying can make it worse?
Drugs can make it worse because you have serious side effects of drugs. For example, on Prozac, you can get severe agitation. On Prozac, your whole body can shake. And paradoxically, if you're on Prozac long enough, the brain makes an adjustment to the drug and you'll get depressed again. These are not definitive answers to the resolutions of problems. You have to deal with the issues that causes you to be disturbed.
So you focus on the issues, and if you need medication, you're not opposed to it, but only if it's indicated.
Medication may facilitate recovery by dampening anxiety. When their anxiety is dampened, they're more apt to talk about problems that otherwise they feel too threatening to talk about.
I see. Would you like to add anything more about how your approach differs from your typical psychiatrist?
Well, typical psychiatrists will get an intake history focusing on symptoms, how anxious you become, what do you do when you're anxious, but they don't ask the person why you're anxious. Once they prescribe medication for the symptoms, then they may see the patient once a month. In residency programs beginning in the 1990s, they did not teach the residents to do psychotherapy. They taught them how to prescribe medications. That's why they call themselves psychopharmacologists.
Do you think that this may have to do with the fact that they want to see more patients in a shorter period of time?
No, I don't think so. I think that psychiatrists are very, very threatened because they were getting fewer and fewer patients. Social workers and psychologists do therapy, and if there's a problem that's determined by malfunction of the brain, that's really for the neurologist is a disorder of the brain. So psychiatrists are getting fewer and fewer patients. The one thing that they have able to do that social workers and psychologists cannot do is to write prescriptions. So they're all focused on writing prescriptions addressed to symptoms and not to the underlying problems.
Sounds to me like they're trying to save the profession, but maybe I'm jumping off of a...
No, it's done with perfectly honesty. No, this is a step at least. They believe in what they're doing.
So they do believe
They're not
that,
being dishonest.
Of course. I mean, Some perhaps, but no,
No, well,
certainly not.
That's in any profession.
Sure, sure.
You expect that. But most of the psychiatrists do in good faith. It's just that their belief system is different from mine.
Absolutely. So you focus on the root cause. What's going on
Absolutely.
underneath? That's very interesting and refreshing.